last year we spoke about healthcare and the effect COVID had on healthcare. And by now, the analysts and the market were hoping that that was behind us, and it's certainly something that is not the topic of conversation or the front of the newspaper article every day anymore. And but nevertheless, if you speak to anybody in healthcare, there's been a long shadow of COVID hanging over the sector. And where this manifests itself is, I guess what we're interested in is profitability and margins. And so it has not been what you would describe as a hockey stick trajectory for profitability returning to normal in this sector. And so what we've seen, if you have a look at the chart on the left, which I've taken from Australian Clinical Labs or ACL's recent results presentation, is that in the pathology sector of the diagnostics businesses, these are the sort of national stats. The volume took a hit during COVID, and it has yet to recover to where it would have been had we had no COVID. And one of the drivers for this is at the sort of beginning of the health journey, where a GP consultation results in a referral for a diagnostic service. And then in imaging, which I've borrowed from Integral Diagnostics, you can see also as very similar, this is a similarly volatile growth trajectory in volumes in that business. But nevertheless, volumes are recovering. But the main issue with the health services is they're extremely labour intensive. So if you look at what the key costs are for these businesses, it's labour, consumables, and then there are many other costs such as rent and so forth. But these two are very important, and these charts depict those costs as a percentage of the revenue. So you can see that really volatile section when we're in the height of COVID, and the private hospitals and imaging businesses had no volume, and the pathology operators, their labour costs dropped substantially because they were getting the benefit of the high margin COVID tests. And then on the consumables side, you can see the effect of inflation, which was quite broad-based in the economy, flowing through in their consumables and equipment costs. And we're yet to recover on this, and in fact, labour cost inflation continues to be a feature in this sector, where many of the companies are locked in lockstep with the public sector wages, particularly nurses, where they've been asking for quite high annual increases, understandably so, because they've got rent or mortgages to try and pay off with the elevated house prices in Australia. So what we need is price to try and help those profits. And unfortunately, many of these companies are price takers, but they are able to do a lot of self-help on costs. And there's quite a lot of white space of work in public and private hospitals, defence contracts, and there's also new technology, genetic testing, new esoteric testing, personalised medicine, corporate health screens, which is all outside of the fixed price Canberra-driven revenues. And this is also a benefit which will help those profit margins recover. So we think they look interesting because the market, a lot of that excess optimism has now been beaten out of these stocks. And we are seeing, you can see on those charts that there are green shoots of those cost metrics starting to subside.